webinar is now streaming live on Facebook.
Yes, we are. All right, so I am going to share my PowerPoint. And Richard, if you could record, then we should be ready to go.
Okay, and we're recording.
Okay. All right, so I'm just going to wait a few more seconds for those 11 a.m. right on time attendees. If you're here right now, you're early, but thanks for joining us. Okay, so let's get started here. I am Eric Goldwine. I'm the Policy and Communications Director for the Long-Term Care Community Coalition. And today we'll be going over some technology tips, mainly Zoom, and also going over LTCCC's new Nursing Home 411 Zoom room. Now, if you're already here, whether you're on here via Zoom or Facebook, you are in great shape technology-wise. I'm not lying when I say this. It took me, I had a little bit of a panic because I couldn't even figure out how to get into this webinar as the host. And I actually just got here a few minutes ago, right on time. But anyway, I'm going to walk you through some of the basics of Zoom and other technologies so that you can better advocate for residents in long-term care. And this is going to be a half-hour program, and I'll leave 5 minutes at the end for Q&A. Okay, so first we are a little bit of LTCCC. We are a nonprofit organization dedicated to improving care and quality of life of elderly and adult disabled in long-term care. We also house 2 ombudsman programs. We do policy analysis, systems advocacy in New York State and at the national level. And we also educate consumers, families, long-term care ombudsman, and other stakeholders. About me, I am Eric Goldwine. It's pronounced Goldwine, hence the gold wine on this screen here. I have been at LTCCC since last June. Prior to that, I went to the Mailman Public Health program in New York City, and I was working at Weill Cornell researching chronic pain in older adults, and I was previously a news and sports reporter for the Washington Post. Our agenda today is first we're doing a Zoom crash course, then we're going to look at LTCCC's new Zoom room feature, and this is really exciting. This will be a place for family councils, for other groups that are advocating for long-term care residents to meet and discuss important issues, and to do so in a safe virtual setting, which is especially important in our current climate. Then lastly, and this is going to be, we're going to do this quickly given time constraints, is I'm just going to go over a few of the nursingHome411.org resources you can use. Then I'll leave a few minutes for Q&A. And you can ask Q&A via the, I think there's a questions feature in the webinar. If you type a question, hopefully we'll have time to get to it. Okay, so what is Zoom? You're already here. This is a word, I'm sure, and a program I'm sure you've been, many of you have been using maybe more than you would like over the last several months, but it's a virtual conferencing that allows you to communicate via video or audio, and you can use it with your computer, your laptop, your tablet, your smartphone, your landline, and you can use Zoom to attend meetings or webinars. So today what we have is a webinar. You might have in the past attended Zoom meetings, and I'll go over the difference between those two later. And just an aside, today we're going over Zoom, but there's a lot of tech resources and software that work similarly to Zoom and can provide many of the same advantages as far as communication. And a lot of the principles that you learn to use Zoom can apply elsewhere. But Zoom and other programs like Zoom can help facilitate meetings for resident-centered advocacy. It can help you connect with other families, with other ombudsmen, and it can help you in some cases connect with residents. And as we know, isolation is a big problem right now, and there's nothing that can replace face-to-face meetings, but if you can work with staff to facilitate a call via Zoom or via FaceTime or via whatever technology that they're comfortable with, that can maybe mitigate some of the damaging effects of isolation. So as mentioned before, right now we are in a webinar. In other times you've used Zoom, you might have been in a meeting. And there's important distinctions between these two Zoom settings. So in a meeting, these are more interactive discussions. Usually for smaller groups, you can expect more of a private, intimate setting, not always, but usually. And you can communicate by video and audio, by phone. You can show your face, you can put yourself on mute, and meetings often require invitations. Now, webinar is what we're currently doing. This is more of a lecture and a presentation, and there's usually a larger audience. So you can have hundreds of people in a webinar. That's not what we have today, but in previous LTCCC webinars, we've had over 100 people, and we don't anticipate each attendee is going to ask questions or communicate, but you have that option in a webinar to communicate by chat or use the Q&A feature. Some of the webinars do require registration. This one did, so thank you for those who use that registration feature and are here. We'll be posting this on our website, but there's a link below from the AARP website that offers a lot of the tips that I'm communicating today. And I suggest looking at that and other online resources for advice and for tips. So downloading Zoom, again, many of you have already got this step down. You go to zoom.us, there's a button that says sign up, it's free. On your phone, you can go to your App Store or Google Play and search Zoom and download the program, and it'll walk you through from there. And the same applies for other platforms such as Skype or GoToMeeting or other kind of communication softwares. So joining a meeting, and again, you've already done the step, but to join a meeting, once you've downloaded the program, you'll be taken to a screen as you see in our top right, well, first you might receive an email or a text with a link. You'll click that, and that will take you to the meeting, or you can also join the meeting by seeing if you see on the screen on the top right, there's a join button, and then you'll be asked to enter a meeting ID and maybe a password in order to join. Similarly with Zoom webinars, you in some cases will need to register as you did today. So for example, with this Zoom webinar, you might have received an email or seen a post on our Facebook page, and then you fill out a registration form. And then once that form is filled out, you'll see an email from the hosts of the webinar providing the login information, and then you click that link and you arrive at the webinar. So just three, I'll call these the golden Zoom rules. Be kind, be careful, and remember to mute. The first one is just like any other meeting, you're going to be with other people who just because they might be hundreds of miles away, or you don't see their face, or maybe they're on mute, or you don't hear them talking. This is a meeting, and you should be mindful that these people, whether it's a hot topic or whether it's more of a casual setting, it's just important to be kind and considerate and listen. With that said, you might have some thoughts brewing in your head that you want to keep to yourself. And my suggestion is to just always, even if you think you're muted, or you think that your video is not showing, is to just keep that to yourself if you can, or don't gesture anything mean, don't say anything mean, don't type, and don't become a Zoom horror story. I'll tell a story about this happened to a friend of mine. They were in a Zoom meeting, and it was really boring, but this is what I'm told. And one of the attendees in the meeting was talking to someone who was in the room with him, not in the Zoom room, but in his actual apartment, and talking about how the host didn't know what they were doing, and this and that, and they thought they were on mute, and it turns out they weren't. So this person broadcast their negative thoughts to the entire meeting, and it was kind of an embarrassing moment. So don't become a Zoom horror story. Just when in doubt, be careful, and remember to mute. On the bottom left, this is more for meetings than for webinars, but on the bottom left, you'll see a microphone that says mute. And if you're not talking, or if there's construction in the background, or you have a barking dog especially, you'll want to make sure that that the dog, this is my dog Lucy, I love her, but we don't want her barking in the middle of a meeting. So take advantage of that mute button. It's your friend. And if you're using a landline or a cell phone, you can do *6 and you'll mute your conversation, or you'll mute whatever noise is coming out of your from your computer. So this current webinar is also going to be posted on YouTube, and it's being broadcast live on Facebook. If you go to our Facebook page, the Long-Term Care Community Coalition, on the link is here. You'll see last week we had a webinar featuring Kathy Encino, and we were broadcasting it live on Facebook. You can go to our Facebook page and watch it right now if you would like. So now I'm going to tell you, now that you're experts in the Zoom basics, I'm going to tell you about the Nursing Home 411 Zoom room. Here we have this is a screenshot of the LTCCC team using Zoom. But the Nursing Home 411 Zoom room is a new feature that LTCC is, or a new program that we're launching that will allow family councils, that will allow other groups to use our Zoom account in order to meet with other family members, with other perhaps ombudsmen, other volunteers, and discuss issues surrounding resident advocacy. This is safe and secure. We have a password to protect the room, as with other Zoom settings. It's convenient. You can go on a smartphone, laptop, tablet, landline. You can show your face, but if, say, you are not in a mindset of you don't want to be on camera, you can always turn your camera off. or say you just want to listen in, you can be on mute. But this is a way for people to connect and discuss long-term care advocacy. And people, so we've, I guess for a couple months now, we've been piloting it, and it's been used by some advocacy groups, some long-term care advocates, family councils. And I got a chance to sit on one the other day, and it was a good place for, what I saw was it was a good opportunity for people to connect with each other and share their concerns and have a healthy discussion in order to resolve issues and discuss strategies to resolve issues. Now, this is a 4-step process. Sorry about the arrow, it's covering the link, but we'll be sure to post it. Richard, sorry, if you could actually post that SurveyMonkey link in the chat, that would be great. But the way to set up a Zoom room meeting with our Nursing Home 411 Zoom room is to fill out a short request form at the SurveyMonkey link, SurveyMonkey, that's a form site. And it'll ask you, I think, like 10 simple questions. What's your name? What's your email address? What facility are you affiliated with? I wrote Eric Goldwine is my email. This is a big facility, LTCCC's perfect 10-star health center. But you fill out this information, you do so honestly, we hope, and then you say about how long your meeting is going to be, about how many attendees you expect. Then after that, assuming you do this if you give us enough time to set up the meeting, you'll receive an email from LTCCC with your Zoom meeting login info, and you can share that with the attendees of this meeting. I see there's a hand raised. If you could put your question in the Q&A. Thanks for staying involved and staying attentive. If you could put your question in the Q&A, then I'll hope to get to it at the end, or if not, email you afterward. And then the last step is join meeting. And then this is the tricks section. If you're starting to get very comfortable with Zoom, you can have virtual backgrounds. On the bottom left, you see that arrow next to the video button. It says choose virtual background. I played around with it. So yesterday I was hanging out in space. You can raise your hand and clap your hand with reactions. Thanks to the attendee that actually just raised their hand. You can share files in the chat. So there's a file button right. If you go to the chat button, you can attach a file just like you're attaching a file in an email, and you can share that with the group. And then you can also chat with the entire group, or you can chat with individual attendees. But again, as with before, you want to be careful to not share sensitive information with the whole group, and you just want to be mindful of what you're saying in the chat. And Zoom is not the only, not the only platform. It's the one we're highlighting today, but there's a lot of others. There's FaceTime, free conference call, Google Meet, GoToMeetings. There's all sorts of, and I'm sure there's going to be a new one next year that becomes a new thing. But as the same principles apply, both technology-wise and both etiquette-wise, you want to be kind, you want to be careful, and remember to mute. And I'm going to go over this quickly before our Q&A, but on Nursing Home 411, we have a lot of resources to help you advocate for residents and to help you educate and inform yourself. So where I suggest going on our website is our Families and Ombudsman Resource Center. The way you access this is, first, there's a link. You see it says nursinghome411.org, Families Ombudsman. So you can go there. You can also go to our main page. That's nursingHome411.org. And there's a button on the left that says Learning Center, and then you go to Families and Ombudsman Resource Center. Now, what's in the center? We have a lot of different resources. It's kind of overwhelming in a sense, but we have fact sheets. So these are basic information on anything from dementia care to resident abuse and neglect, to staffing, regulations, a range of issues that you can use to educate yourselves and to arm yourselves with the tools that you need when you're advocating for a resident or a loved one. We have our dementia care advocacy toolkit. We have staffing data. We have handouts, which I'm going to go over with you in a moment. Our Zoom request form, resident-centered advocacy, and we also host webinars, which are posted on this page, and podcasts, which are audio shows about a half hour long, featuring different experts and different topics in long-term care. So this is our forums and tools for resident-centered advocacy page that you can download, you can print, and I say take with you, though I understand that there's a lot less going into facilities in our current COVID-19 climate. But this is a place where you can download forms and you can put them on your phone. There's a resident concern record keeping form, resident assessment worksheet, resident preferences, family council meeting notice, agenda. These are things that you can use to keep track and to assess conditions in a facility. And I know a lot of you are local, so we also have a long-term care in New York State section where we offer New York specific information. This includes assessment of staffing and quality, nursing home data, assisted living and adult home data, enforcement actions. So this is information on fines and penalties at different facilities in New York State. And lastly, or not lastly, but we also have our LTCCC Action Center where you can use this page, and our link is below, nursingHome411.org/action-center, to contact state and federal representatives and let them know your concerns about long-term care. These links, they kind of write the form for you. So you just kind of, you can write your name, your basic information you can add to the letter, but a lot of these are pre-written letters for you to sign on to and then send to your representatives. And then lastly is our Coronavirus Resource Center. If you go to our main page on the top of our website, there's a big text that says, click here to visit LTCCC's Coronavirus Resource Center. And we have different materials, including fact sheets, data sets, news and reports, federal guidance. And one data set I want to go over is we are posting New York data on New York nursing home and assisted living facilities on fatality data and COVID-19. So these are, again, available in our Coronavirus Resource Center. You can sort the information by county, by facility, and you can examine the different data points. So I'm going to leave a few minutes for questions. I saw that there was a hand raised. There were a few in the Q&A. Yeah, I guess, Richard, if you could read this off, and hopefully I can do my best to respond.
Sure. Thanks so much, Eric. I thought that was really excellent. I just wanted to add, some of the tips that Eric gave throughout that program. I think are really useful for those of us, if you're working, organizing a meeting, just to remind the people that you'll be speaking with, about some of the etiquette issues, some of the basic, Zoom tips, etc. So our first question is, can you use the 411 Zoom room to meet with residents?
Yeah, Richard, I'll actually let you take that.
So we've talked about and all the materials about family councils, meeting or organizing and meeting, but certainly that can be used for and with residents as well. We just didn't focus on that because as you all know, a lot of residents don't have access to the internet as easily, but many of them and growing numbers of them do. So certainly that could be used for meetings with residents.
Mm-hmm. And I'll just add one thing to that. So you can use that. It's also I would suggest using whatever, especially in that whatever program is easiest for you and for the resident that you're working with. So it is possible that our Zoom room is the easiest. It's possible that maybe you've found success using FaceTime. So I would recommend using what works best for you. And it's possible that our Zoom room is the best option for that.
Yeah. And as Eric said before, this is, we were talking mostly focusing today on Zoom and the Nursing Home 411 Zoom room, but this could, you could certainly do communication through private Facebook pages, which are not open to anyone unless you invite them and allow them to come in to the Facebook page. So there's other things. If people are interested in us discussing some of them, as Eric said, we have our own Facebook page, but we certainly want to facilitate residents and families and ombudsman communication as much as possible. Shoot us an email at feedback@ltccc.org, and we'd be happy to set up a future program or provide some technical assistance. I'm going to actually skip ahead because one of the last question that we received, then we'll go back, I promise, was related to this. Why is your Zoom Nursing Home 411 any different from anyone with a Zoom account setting up a Zoom meeting with a family and nursing home resident? It's not. So we're just offering this, as Eric has been saying, as a service to the community, but people can certainly set up their own Zoom rooms, Zoom accounts. With a free account, I think you can meet for up to 40 minutes, and then that's the limit of the Zoom meeting. That may be enough. And certainly, as Eric said, there are other platforms that can be used. Right. Eric, do you want to add anything there?
Yeah, no, just so the time limit you mentioned, ours is unlimited time. With that said, if you have the resources to set something up through your own Zoom account, and you prefer that and you think that it will be easier for you, I recommend doing that.
The next question was off topic. Are open window visits legal in New York State? Excuse me. So there are, as I think everyone knows, there are federal recommendations, not requirements, but recommendations for how states are opening up to visitation. And then New York and other states have implemented some, standards or guidelines within those recommendations, but it's been very open. This is something that we've been advocating about to make it more open and to really implement stronger visitation. So definitely stay tuned for that. In terms of window visits are have always been allowed, and at least in terms of the states and in terms of the federal government, it's really up to the facility what they are willing to do on their property within those confines. So and again, it kind of gets at the issue that I was just saying, is that we've been advocating around this, that there should be, frankly, stronger guidelines that are very specific in terms of what facilities should be doing based upon what's going on with the coronavirus in their facility, in their community. We're concerned that it's too loose and too open for interpretation by facilities, and some facilities, unfortunately, are taking advantage of that and are not opening up to visitation, even on their property outside, or outside one-on-one visitation at a safe distance, or visitation in the facility. Excuse me. I just want to move on. There's a couple of questions. The next one is how do you put a virtual background on the computer?
Okay, so on the bottom left of your screen, you'll see a button that says video. It might say stop video, and to the right of that, you'll see a little arrow pointed down. If you click that, and again, this is more for meetings than for webinars, but if you click that, you're going to see something that says choose virtual background. And I'm actually going to do this right now. Choose virtual background, and you'll see a few. So there's like a bridge, there's grass, and yeah, it doesn't look, I guess I'm lost in the grass right now.
Oh, there you are.
Yeah, but there's different options you can do. And it really, as you just saw, it depends on the lighting of your room. And there's, yeah, if your room isn't lit the right way, it might look a little funky. But yeah, that's how to do it. There's just a virtual background setting, and you can put yourself on a beach. You can go to space, and you can bring a little levity to whatever meeting you're in.
Thanks, sir. There was one last question, which actually David had withdrawn, but I think it's worth asking and answering. He had asked how we got the text at the bottom to show up the closed captioning. And I think that this is really valuable. So for people who may be hard of hearing, et cetera, the closed captioning isn't perfect, but it can be, it's fairly good. And I think helpful, obviously, for people who have trouble hearing. So Eric, if you can quickly.
Yeah, thanks for asking that. And just a full disclosure, we, a few weeks ago, couldn't figure out how the closed captioning was there. This was actually one of our tech support problems. It wasn't, we couldn't figure it out. But anyway, through Microsoft PowerPoint, there is a, I'm going to exit so I point in the right direction. In Microsoft PowerPoint, I'm going to open this screen here. There is a button or a button that says use subtitles. So, and if you check that box, then slideshow. If you check that box, then it'll put closed captions on your meeting. And yeah, so it's through it's a little confusing because it's not through Zoom, it's actually through PowerPoint. Now there are through Zoom closed captioning options, though they require different services that you need to pay for. But yeah, the PowerPoint option has been our solution, our shortcut to getting transcriptions on our presentations.
Terrific. Well, thank you. Thank you very much, Eric. And thank you everyone for joining us today. As I think Eric mentioned before, this, participating in the program is not necessary to use the Zoom Room feature, which I posted in the chat, but this recording will be available in case it's helpful for people in the future. And again, we'd be happy to do further programming or provide some technical assistance to help, the family members and to the extent possible, the residents to be able to communicate, now and into the future. I think it's a really good, option, especially since we can't meet in person. And I anticipate even when nursing homes reopen for visitation, which I hope will be soon, that it'll be still a long time before we're able to have, group meetings in a single room, the way we have done in the past as family members and as resident councils. Lastly, I want to just mention that the federal government provided funding for any facility that applied for it to receive up to $3,000 for technical equipment like iPhones, iPads, other branded pads, of course, computers, et cetera, for their communication. So I know that many facilities, but not all, did apply for that funding, but that has been available as a grant of up to $3,000 per facility. So hopefully your facilities will be getting some equipment to help residents, et cetera, to, for their communication and entertainment. With that, I'm going to say thank you again, Eric, and thank you everyone for joining us today.
Thanks all. Bye.
Bye-bye now.